Hey guys, it's Dr. Daniel Sugai, board certified dermatologist. Today's video is about acne myths, and we see this a lot on social media. And I just want to clarify and debunk some of these misconceptions about acne. Acne is very common, is sadly associated with a lot of mental health issues, depression, anxiety. I'm seeing a lot more mental health issues with my younger patients, which is unfortunate, especially during this pandemic. But I do feel like that's the most fulfilling part of my job, is making younger patient feel better about their skin. We don't want perfection. We don't want perfect skin. We don't want poreless skin. That's impossible to achieve. But if we can get some clearance of their acne, really important to get it under control and prevent, because prevention is key, more so than treating acne once it's out. So today, let's jump into some myths, okay? So myth number one, you're not washing your face enough. And I've been seeing people message me about this. Like, I feel so bad that I've judged my friend for so many years. I've thought they were not hygienic, they were dirty. When they would go to the beach and they'd show me their back being covered in acne, I used to just assume they didn't shower. Those are all misconceptions. Yes, you can say there is a hygiene component. If you don't wash your face, if you have makeup on and you go to bed with makeup on, yes, you're gonna occlude your pores. And the heart of acne, where it begins, is in the pore itself, the hair unit, the follicular unit. And that pilosebaceous unit, if it gets clogged up with dirt, excess sebum, it'll feed the P. acnes bacteria and it'll become inflamed and start up this acne inflammatory lesion, or it just gets clogged over and becomes a whitehead or becomes oxidized and it's a blackhead. So there's different types of acne, and cleansing is an important feature in your acne treatment. And so I talk about salicylic acid, which is a beta hydroxy acid, goes down in the pore, cleans out your pore. And also benzoyl peroxide is a nice antimicrobial exfoliative property in your cleansers. Yes, you can use that as a spot treatment. La Roche-Posay will have a spot treatment, Effaclar spot treatment with benzoyl peroxide. That's fine to use every once in a while, but if you're using that all the time, then it's probably a signal saying you got to go see your dermatologist ASAP, because that is not what we want. That means you're not under good control, okay? And so cleansing, you don't want to overdo it, because if you overdo it, break that skin barrier, and you start to let all this, you start to get inflammation from scrubbing or from cleansing too frequently. That's not good for your skin either, and then you can lead to scarring, eczema flares, just different types of contact dermatitis rashes on your face. Obviously, is something we don't want. So the people who have acne issues, you can't just jump and say they're probably not washing their face. They might be doing it, or they might be overdoing it because they're kind of panicking at that point. Myth number two, scrubbing your acne away is what you want to do. That's better. No, you don't want to scrub your acne. Take away all those cleansing brushes, put away all those loofahs, and you're trying to scrub the acne away. That's a very dangerous game you're playing. And so I would say that I treat things with ingredients, with your skincare, with prescriptions. That's a better way of dealing with the inflammation instead of scrubbing it away. Physical exfoliation can be dangerous with an active lesion, because you can really cause a hole, a divot, just permanent scarring. And scarring treatments are very, very expensive, whether it's chemical peels that you need to do over and over, or the more expensive high-end lasers, the resurfacing lasers. Those can really add up in your in terms of budget. Acne is just so common, and you see even like Lil Nas X on TikTok popping a pimple on his forehead. Everyone deals with acne, and so I want to normalize it, but we also have to not normalize popping your acne on TikTok and trying to get views, because it's also a dangerous game you're playing with, because one, it can lead to infection when you pop your own pimples, and two, you don't know when it's appropriate time to actually go in and drain an acneiform lesion. Because if you go and drain or pop or pull out and extract the contents of an inflamed pustule or acne bump, and it's infected, it could really lead to a hole. And so I did do a React duet video to this one young gentleman who pulled out large pustular contents out of a pimple on his nose. And people were like, well, what should you have done? There's lots of other things we could have done. If he had seen a dermatologist or a doctor, we could have treated it without having to go after it in that physical, pretty dramatic way, where it has left him with a hole, and he kind of jokes that he now has a nose piercing hole. So it is something you don't want to mess with, because those types of scarring are permanent. And I was worried about him leaving a hole in his follow-up videos. He does have a hole in his nose. And so scrubbing, pulling, extracting, when you don't know what you're doing and you just see one video on TikTok and you're like, oh, I can do that, I can pop it. It can lead to some serious scarring afterwards, okay? Myth number 3, greasy foods cause acne. So what do you guys think? So greasy foods, if you think about pizza and such, yes, you could argue that pizza can cause acne flares, but it's more because of the bread, the carbohydrates. So things with high glycemic index foods can cause inflammation in your skin, as well as cow's milk. So dairy, but especially cow's milk, can lead to increased inflammation, increased sebum production. It might be due to the hormones that are involved with making the cow's milk low fat, because the low fat skim milk forms are big culprits. And so not so much hot dogs and the greasy foods, the grease itself isn't going to cause more grease in your face, but it's more, in studies wise, the high glycemic foods and dairy are potential dietary culprits that might be worsening your acne. In terms of meats and the hot dogs and such, you can also argue that it's just not good for our general health, and it will reflect in your skin if you're not being healthy and you just have a poor diet. Yes, your skin might look more dull. You might have increased aging. Increased sugar intake can increase collagen degradation, and so just have a nice, well-balanced diet with good vitamin D, vitamin C in your diet, and folic acid, and having a good collagen in your diet is really good for your skin, and staying hydrated as well. Okay, the other myth is derms only want you to take oral medications when you come to see us. That is also false. I would say that when you come to see me, there is a therapeutic ladder that we talk about, starting at over-the-counter treatments only, and sometimes I might just write down my favorite over-the-counter treatments for you to take if you have mild acne that's not scarring. If you have mild to moderate acne, then we'll talk about topical medicines that are prescription. If it starts to becoming more on the moderate side of severity, we might talk about then the oral treatments like oral antibiotics or spironolactone and such. But we won't jump to any type of oral medication right off the bat. We definitely will personalize it to you, and our goal is to make it a safe treatment that you could be happy with. And long-term, oral antibiotics is not the goal. We don't want you on antibiotics for a long period of time, because you can get resistance and such and change the bacterial flora, the gut flora permanently. So we don't want that. There are complications to taking oral antibiotics, and I totally am aware of that, and I don't want you to think that that's all we're about, is just throwing up antibiotics at you, throwing the kitchen sink at you and just hoping that you get better. No. The other myth is the more products to dry your skin out, the better. Our goal isn't to dry you out necessarily. People have said, oh, I'm using an astringent toner, I'm using rubbing alcohol on my face to dry out the acne in my face. That's not what we want. We want to find a good balance in treating your skin but not breaking the skin barrier and totally destroying it and making it raw and dry. There are ways to go about it in a nice, harmonious way. And so I would say hold off on putting hydrogen peroxide, alcohol, those crazy toners on your face. I'd say that a good cleanser, a gentle cleanser, and maybe considering salicylic acid or benzoyl peroxide if you're not allergic to them. That's something you could consider. But I don't think the goal is to necessarily dry you out, okay? Yes, you might take isotretinoin as an oral medication. That will dry you out, and that's what we expect. But all the other treatments, we will talk about dryness, but the goal isn't to dry your acne out, okay? It's really to bring down the inflammation either from within or topically, and to take away the bacteria that is infecting your hair follicle and causing those acne lesions. And the last final myth is that all acne is made the same. No, there are different types of acne. There's pustular, inflammatory acne. There's comedonal acne, where it's just blackheads and whiteheads. There's nodulous cystic acne, where you have deep nodules and cysts under the skin, and that can definitely lead to scarring. And there are different causes for acne, whether it's hormonal, dietary, stress-related, occlusive, where you're wearing a cap or a helmet and that is occluding all of the hair follicles on your forehead, and that leads to acne. There are different types, okay? And not all acne spots are necessarily good old acne. There are cases where I will see pustules on the face and it's actually Demodex follicularum pseudofolliculitis, say, and we have to treat it a different way with an anti-parasitic medication and not so much your traditional acne medications. Other things you can see in your late 20s to 30s and on, even to your 60s to 80s, is you can get acne rosacea, where the center of your face will get broken out around the nose, the inner cheeks, your forehead, your chin. That's where you have to change gears, and it's not your traditional acne medications with salicylic acid, benzoyl peroxide, because that can irritate acne rosacea. You have to be very careful with acne rosacea, and you can't go at it with all of your drying ingredients because you can really get into some trouble there, okay? All right, guys, so I just wanted to quickly go over those myths. I hope they were helpful. Again, this does not replace a doctor's visit. It's just some things out there where I see online or in person in clinic, and I just wanted to clear that up from a dermatologist standpoint, okay? So again, for me, I'm a board certified dermatologist. I did my medical school training in Hawaii, at University of Hawaii, did my residency, dermatology residency at Harvard Medical School's combined program, and now I'm a board certified dermatologist out here in the Seattle area. Thank you guys for making appointments with me. It's been great meeting you guys in person. But then again, I want to emphasize, if your acne is worsening or causing any scarring, definitely make an appointment with your local dermatologist ASAP, because that's to the point where you are not well controlled. If you're using the spot treatment all the time with benzoyl peroxide, or using hydrocolloid patches, whether they're small or the big sheets on your face on a regular basis, that's not what we want either. So if you're having those issues, definitely make an appointment. Okay, so thank you guys. Don't forget to like the video, and also don't forget to subscribe to the channel. Take care and peace.